Dynamic auscultation of cardiovascular system. Dynamic auscultation refers to the changes in circulatory hemodynamics by physiological and pharmacological maneuvers and its effect on the heart sounds and murmurs. Respiration. During inspiration, murmurs that arise on the right side of the heart become louder as it increases venous return and therefore blood flow to the right side of the heart. Left-sided murmurs are either unchanged or become softer. Deep expiration. The patient leans forward during expiration to bring the base of the heart close to the chest wall, and in this posture, aortic regurgitant murmur and the scraping sound of a pericardial friction rub are better heard. Left-sided murmurs are louder during expiration. Valsalva maneuver. In this maneuver, the patient is advised to close the nose with the fingers and breathe out forcibly, with the mouth closed, gains closed glottis. Valsalva maneuver has 4 phases. At the beginning, there is rise in intrathoracic pressure and transient increase in left ventricular output. During the straining phase, systemic venous return falls, resulting in reduced filling of the right and left ventricle. As a result, the stroke volume and the BP falls, but the heart rate increases. Most of the cardiac murmurs become softer. However, the systolic murmur of hypertrophic cardiomyopathy becomes louder, and the systolic click and the murmur of mitral valve prolapse begin earlier. During the release phase, first the right-sided and then the left-sided cardiac murmurs become louder briefly before returning to normal. Phase 4 represents overshoot of systemic arterial pressure and reflex bradycardia. Stand-in and squatting. When the patient suddenly squat, from the standing position, venous return and systemic arterial resistance increase simultaneously, causing a rise in stroke volume and arterial pressure. Most of the murmurs become louder. However, left ventricular size is increased, which reduces the obstruction to outflow, and thus the intensity of systolic murmur of hypertrophic cardiomyopathy is reduced, while the mid-systolic click and murmur of mitral valve prolapse are delayed. In squatting to standing, the opposite changes occur. Isometric exercises. Sustained hand grip for 20 to 30 seconds increases systemic arterial resistance and blood pressure. The systolic murmur of aortic stenosis may become softer because of the reduction in the pressure gradient across the valve, but often remains unchanged. Most other murmurs become louder except systolic murmurs of hypertrophic cardiomyopathy, which is softer, and the mitral valve prolapse murmur is delayed because of the increased ventricular volume. Amyl nitrate decrease left ventricular afterload by dilating the peripheral arteries and would decrease the murmur of mitral regurgitation. Rarely used now. A summary of the dynamic auscultation of the cardiovascular system is depicted in the presentation. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.